So the word delegation, like, you can define it anything you want, but basically a nurse and it's a responsibility for the patient. And sometimes there's portion of activities that is required when taking care of the patient is to delegate to other people that form part of the medical team. Basically, you giving out your responsibility to another person, but at the same time maintaining that responsibility and accountability in terms of outcome. Um, you you and the nurse can do that to a UAP or LPN, basically portion of the work that is involved in the care of the patient can be delegated to them, but responsibility and accountability regarding outcome is still yours. The nurse cannot delegate judgments that pertain to nursing. And so, in order to do that, you have to um, know certain things as a nurse, what you need to do. So your exams, you focus on this information. Before you can do the delegation, you need to know these five right of delegation. And the number one is tax. Okay. The definition is sometimes if you don't define it well, you get confused. Basically, to delegate a tax to LPN or UAP, they should have their own scope of practice. That is all what it's about. You can delegate a task to them, but they may not be competent. So you can be UAP who has been assigned a specific scope of practice based on your designation of a UAP or LPN, but you may not be competent to do that job. So the nurse can delegate, make sure when he delegating is the right task. That means the scope of that practice of the person is delegating is appropriate. That is the key. Okay. And to do that those right tasks, we're talking about tasks that has a predictable outcome. You know what is going to happen. Okay. And so, and he has low risks. Risks is very low. So that's the task you delegate. The task that has a low risk, there's a predictable outcome, and then the individual you delegating to is within their scope of practice. So when they ask you a question, they usually don't give you straightforward. They will tell you, they describe it, and they will ask you which one of these five delegation is applying to. The right task means they have the particular scope of practice, the thing has low risk and a predictable outcome. What is the circumstance? Well, the circumstance in situations, there's things you can do to delegate. So in circumstance, you got to make sure that the patient, you're talking about stability of the patient. So stable patient, and then non-complex task. The task is non-complex. So you got to, these are the words, the buzzwords, you should have it on your mind. For task, you're talking about scope of practice and predictable outcome. For circumstances, we're talking about stable patient, because sometimes when patient come in is unstable, even though a UAP can do vitals, in that circumstance, the UAP shouldn't be assigned the patient taking vital because the patient is unstable, even though it's within their scope of practice. That's the key things I want you to put it together without not memorizing. It's within my scope of practice to take this vital, but it's not the right circumstance. The patient is unstable. So the nurse should not delegate that. The next one is person. Okay. Right person. You may have you may assign a right task because the person you think they have and is within their scope of practice. The circumstances may be appropriate, but the person is not appropriate because they don't know what we call KSA. I call it KSA. Every thing we do, there is what we call KSA: knowledge, skills, and ability. KSA: knowledge, skills, ability. The nurse, the UAP or the nurse or the LPN may have the scope of practice because of the school they went. The circumstance may be appropriate, but they may don't know the knowledge. They don't have the knowledge and the skill and the assessment at that time for them to do the work. And so they may not be competent enough to do that. So the nurse, you should verify that they have knowledge, skill, and ability. And the one being delegated to should make sure the delegator be competent for that problem that is going to be assigned to them. Then the direction. You, the nurse, if you give the right tasks because they are within the scope and the circumstances appropriate, and patient, the provider has a knowledge, skill, and ability, you also need to check to ensure that you're giving them direction, clear instructions, what they need to do if there's a problem. They should report to you, and the delegator should make sure they understand what circumstances they should call. So that is giving them right direction. The direction is different from supervision, okay? Don't get that one confused. You may give them the right direction, but if you don't, oh, you got me. So sometimes, like I said, you may have the right direction, but there is no supervision. The supervision means you intervene if they do something wrong. You right away intervention. There is intervention. You intervene when they do something wrong, basically, or you continue to monitor what they're doing as needed. So those are very important. That is supervision and evaluation. Intervention, direction, you telling them that if something happened, they should let you know. You give them specific warning. Heart rate of 110, call me. Blood pressure of 90, call me. But supervision means they're doing something and you right there, you just correct them at the moment, spot learning or intervene exactly so that they don't cause problem to the patient. I see delegation as a safety problem. You will not delegate anything that you think the UAP or LPN cannot do. If they do it wrongly, it cause harm to the patient. So when you see a delegation question, think safety, safety. What can I do to ensure safety? It's all safety question. So think in terms of safety about the patient so that you don't cause harm to them. So what can the RN do? It's easy. RN, I call it heat. So the education, they assess the patient, they do all the assessment and education and all initial assessment. And they provide teaching, especially at discharge. So discharge, teaching, education about medication. And they also do blood transfusion, initial blood transfusion. So the EAT is the most important. And they are involved in taking care of the patient in terms of initial blood transfusion. So, and they cannot delegate their judgment to anything. These are the 4 things you need to know and block your mind when you see delegation question. If you involve education, RN has to do it. Assessment, RN has to do it. Initial assessment, they have to do it. Teaching, they have to do it. Initial blood transfusion, they have to do it. Anything about judgment, they have to do it. There's no, that's all. That's all you need to know. Focus on that, and that will be fine. The next one is the LPN or LVN. And I have an acronym. I think sometimes it helps you focus. So MMR most. So that's what I do. When I see APN, UPN question, I do MMR most. And M, the first M is monitoring. They're just monitoring. So the answer choice will say monitoring findings of the RN. So findings RN already seen, already done the initial assessment. Well, the LPN or UAP will monitor those findings. And then they do most medication. They can give most medication, not high risk medication like IV medication. They cannot do that. Not high risk medication or medication that can cause problem to a patient. High risk medication, or we call it advanced medication. They can do that, but they can give most medications. They can reinforce teaching. The same thing as monitoring, reinforce teaching. They can provide the initial teaching, but after the patient has been taught, they can reinforce it. Okay. The other M is the same thing, so that you can focus is the same thing, monitoring and most medication again is the same thing. They can do stoma care. So stoma, I like to use the stoma instead of other colostomy or anything. When you say stoma, it can be gastrostomy. That means stoma means any portion of the GI tract that is on your skin. So gastrostomy, colostomy, ileostomy, all of them are stoma. And therefore, they can take care of it. And then the S is a special test. Like they can listen to vowel sounds, they can listen to long sound, they can check neurovascular exams. So they can do special tests, which is long sound, vowel sound, and neurovascular exams. And the T, they can do tube feeds. So you see how easy it is? LPN, LVN, they do MMR most. Monitoring, RN finding, most medication except advanced medication, IV medication, they can reinforce teaching. And you come back to the M again, you say MMR most, which is monitoring and most medication. Do stoma care, any gastrostomy, ileostomy, colostomy. S is special test, which is long sound, vowel sound, and neurovascular check, and it can give 2 feet. This is all. You just put in your mind, you write it on the side, and you look at the question. If it's there, you check it. Make life easier for you. And the last one, the UAP, I mean, I know there's a bunch of information you will read in books. I've made it easy for you. Anything that does not require thinking. I know they're going to school and that other thing, they do routine care, but I don't like the word routine care. Anything that does not like no thinking at all. There's no thinking. They don't have to use their brain. They just go and look and do it. Like checking the patient urine output from the urinal. Where they just pour it and they measure it. Weigh a patient, well, you don't have to think. You just put them on the scale and you weigh them and then you measure it. Check their vitals, you put the blood pressure there and the machine will do the reading. All you need to do is record it and tell the RN. Check the SAT, you just put the machine there and will do. So they don't have to do anything with their brain at all. Even though they're very smart people, the way for your exams to remember is nothing that involves thinking, routine stuff. That's all. I make it easy for you. Routine stuff, no thinking, no assessment, no education. I'm coming to check whether you're eating. That's all. I'm standing there so that you can eat. That's all. That's all. Leave them, put them in the bed. That's all. They don't have to think about anything, no assessment, nothing like that. So that's what they do. So I'll use the question and then we can answer all of them and you see how we can apply them. And I'm using blood transfusion as an example, okay? I'm using blood transfusion as an example so that you can see it. So for blood transfusion, Usually when you want to transfuse blood, you need the blood. So the UAP can go and get the blood from the blood bank. So they go there, get the blood from the blood bank. The blood comes, the RN and the LPN, they verify. So you need two nurses so they can verify that it's the right blood and right patient. The UAP then can check the vitals of the patient before the blood transfusion, before you start the blood. As soon as the blood transfusion is start, who initiate the blood? The nurse. After they get verified by the LPN, the nurse initiate the blood transfusion. The RN. Within the first 15 minutes, you pay attention. First 15 minutes, all vitals is done by the RN. So within the first 15 minutes. Why? Where anaphylactic shock is common at 15 minutes. This is the main reason why the RN has to do the vitals within the first 15 minutes when the blood transfusion initiated. After 15 minutes, if the patient is stable, then it can delegate to the UAP. If the patient is not stable, RN continue to do the vitals. The LPN can monitor, like you said, MMR most. They can monitor the transfusion after 15 minutes. So they will be able to do that. You see how I put all of them together. So that's how you answer questions using all of them together. So we can apply it in the next question. So you have a RN, LPN, and a UAP are caring for a patient admitted to the surgical unit. Which tasks are appropriate for the LPN, UAP, and RN? So when they give you like that, I intentionally give you, usually they want you to pick one. They will tell you which one is appropriate for LPN, or which one is appropriate for UAP, or which one is appropriate for RN. I put them all of them together so that we can select as we go. Usually they can give you 3 of them and they say choose only one, LPN or this one, but I want you to select for all of them so we can see. So vitals of the patient 3 hours after admission, where patient is stable. So after admission, who usually admission vitals has been checked 3 hours. Who usually check vitals? Well, something that doesn't require thinking. So this is a UAP staff. Change stoma bag. Who does MMR most? Well, that is the LPN staff. Change tube feedback. That is a LPN staff. Weigh patient. Well, that doesn't require thinking. So that is the UAP staff. Watch patient while eating lunch. Patient eating lunch, I'm standing there. I'm not doing anything. I'm not thinking. It's a UAP staff. Check blood glucose before the patient eats. Who check vitals? Blood glucose is part of the vitals. So UAP. They're not making any assessment. They're just checking the sugar when the patient is eating. Reinforce teaching. Word reinforce. MMR most. Go back and listen again. MMR most is always LPN. Reinforcement, monitoring, reinforce teaching. The teaching is already provided on expected side effect of a medication. This is LPN. Assist client to the bathroom. No thinking, just taking them to the bathroom. UAP. Notify nurse if client heart rate is greater than 100. Even though it said notification, there's no thinking. You're looking, if the monitor said 100, you call. And that is UAP, checking the vitals and seeing that. This is usually happening when you give them direction that call me when that happens. Measure client urine output. You're just measuring the urine output. You don't checking if they pee, that require an assessment, but you checking, you measuring it from the urinal. Well, that's UAP. Educate patient on discharge instruction. Word education. Who does it? That's the nurse. So RN does that. Listen to the long sounds after epidural treatment. Remember MMR most. The S is special test. Listen to the lung, listen to the bowel sound, and then neurovascular check. But this is done by what? The LPN. But this question say you listen after treatment of what? Epidural. Pay attention. If I have treated you with epidural, I'm listening to your lung, I'm doing an assessment whether the medication has worked. So pay attention when they give you this question. It's not just listening to the lung, but you listen after epidural. This is an assessment. So that's done by RN. So this is all for delegation. I hope you get it. Remember, the nurse does, RN does the heat plus initial blood transfusion and medication. MMR most is for LPN, and then the UAP, no thinking at all. Good luck in your exams, and I hope you all the best.